Hi, my name is Edson Torres, and I will be talking to you about salaries between doctors and soccer players. My father has always told me to follow my dream, no matter how hard I may have to work for it. However, my mom would always be the realistic one and tell me to think about my future. My dream as a child was always to become a professional soccer player. I trained with my family and my dad all the time, and it just was great. As I started to grow up, I realized I had to let that dream go because it's almost impossible for anyone to go pro. So I started thinking about what else I could do, and then I thought about being a doctor. But then I learned that it was 4 years for undergrad and then 4 years in medical school, plus you have to do residency. I just didn't think I had all that time. According to salary.com, doctors make about $200,000 a year, which that's actually a great amount of money, and you'd be considered wealthy. The problem is that with doctors, you're usually on call 24/7 and will almost never be able to spend time with your family. For instance, a teammate of mine in high school once had the opportunity to receive a brand new free car or have college paid for. And this was just because his dad was never there and he wanted to give him something to be remembered by. Soccer players, however, make so much more money than they have to. Even though I am a soccer player, I still believe that soccer players make way too much money. They don't have to go to school and spend hours studying for exams, and they make more money than doctors. Neymar, a soccer player for PSG, broke the transfer record and is currently making about $116,000 a day. I think that's a lot of money because in 3 days he'll be making more than surgeons do, and all he really does is play soccer games. This speech is for anyone that believes that doctors are being paid way too much for all that they do. I believe that soccer players should not make more money than doctors should because doctors do more for people, they put in more time, and they work harder. While professional soccer players such as Neymar can make a large amount of money based on natural talent, doctors make significantly less when they are, in reality, being more beneficial to society. Soccer players should not make more than surgeons because doctors do so much more for people. Doctors treat life threatening illnesses and conditions, a necessity that so many people need, including athletes, need on a daily basis. One of the most important things that a surgeon offers to someone is the fact that they can fix you if you are broken. If there's ever times where you have internal problems like internal bleeding and require medical attention, a surgeon is one that can perform surgery and fix whatever may be wrong. According to the National Cancer Institute, 38.5% of people will be diagnosed with cancer throughout their life. And a common way of fixing this is by a surgeon performing surgery to remove the tumor and the surrounding tissue. And that can increase a patient's chances of living dramatically when surgery is performed. Another reason that proves why surgeons should be getting paid more than athletes is because without surgeons, there are so many athletes that just simply wouldn't be able to keep on playing their careers. Athletes can't continue if they find themselves injured without receiving the proper medical attention, and doctors don't necessarily need athletes. Athletes are incredibly dedicated and passionate about their sports, and this may be admirable, but they too need doctors when they find themselves injured. Every time an athlete decides to play a sport, he or she must know what is put on the line. There's a soccer player by the name of Saul Niguez that plays for Atletico Madrid that has severe kidney problems, and every time he puts on his jersey, it actually costs him a lot of pain. There was a game where he received a kick directly to the kidney that made him bleed internally. Without the help of a surgeon, Saul would have died within hours because he decided to play a game knowing the risk for him. Although I play a sport, I know that at the end of the day, a sport is just a game. People enjoy watching professional soccer games at stadiums or even on television, but no one's life depends on whether or not the team can play. There's not a single person I know that would not want to make $350,000 or more a year. However, not many people want to spend more than 10 years going to school without receiving income. Becoming a doctor is not something that can happen overnight. A doctor has to go through 4 years of college to get their undergrad, followed by another 4 years to go to medical school, and once that's done, they have to go to a hospital and do their residency before they can actually be called surgeons. Although there are many people that would be willing to go through all this school to become a doctor, not everyone can do it. Pre-med school is very rigorous, but getting into medical school is very difficult. In fact, according to Kaplan, some schools are so selective that they only allow fewer than 3 applicants out of 100 that apply to the school. Not everyone is blessed with a photographic memory either. People have to spend so much time reviewing for an exam that they may have in the near future because there's just so much information. There are many requirements that must be met when applying to medical school as well. One must obtain a high GPA, score competitively on the MCAT, and be an overall well-rounded individual with experience. This means to be a competitive medical school candidate, students must have exposure to health care such as volunteering in hospitals or shadowing doctors. Neymar, as mentioned earlier, is currently 25 years old and is already considered a millionaire. When a doctor is 25, however, they are still in medical school or possibly starting residency, and during this time they could still be in so much debt because they're not being paid as much as regular doctors get paid. The process of becoming a doctor is very long. While this makes sense because they are potentially holding individuals' lives in their hands, and a doctor's salary should reflect this. Since a doctor spends so much time learning how to properly do their job, their payments should be higher than an athlete who has made it professionally based on talent opposed to schooling. A soccer player does not have to spend many years at school in order to become a professional athlete. He or she must have been able to start at a young age and be the best player in the area to go professional. Money is also a big factor going pro because you can pay a club a lot of money to get you a tryout spot. There are no hard tests that you have to take in soccer either, like being a doctor. One of my professors once told me that it's not about how smart you are. The only thing that truly matters is how badly you want to outwork your competition. The amount of money that an athlete makes for their talent is way too much in comparison to a doctor who dedicates all their time towards saving lives. Doctors are always available to do their important job. In becoming a doctor, there is so much that an individual has to learn before they are able to actually practice. As mentioned before, one must go through many years of schooling and observing in order to earn the title of being a qualified doctor and being able to treat a patient. Once this is complete, a doctor is expected to be working or on call nearly 24/7. A doctor, especially in the early ages of their career, must be ready for the unexpected. No two cases are necessarily the same, so a doctor has to be ready to see a patient and treat them accordingly in a timely fashion. Illnesses do not wait for a time that is convenient for the doctor, so they must always be prepared. Being an athlete is not time sensitive. Sports are primarily for leisure, and while there are set dates for games and times for practices, the job of a professional athlete does not necessarily have the opportunity to save an individual's life. Although sports are extremely important for the mental and physical well being of an individual, it does not compare to the work that a doctor does into saving someone's life. An athlete works very hard as well, but they do different kinds of work. A professional athlete practices about 2 times a day and plays games on the weekends. Athletes also begin getting paid when they are very little. There are so many 16-year-olds in the world of football that they are already being paid way too much. Martin Odegaard was a 16-year-old that was making $80,000 a day back when Real Madrid signed him. In conclusion, doctors work too hard and give up too much only to be making less than professional athletes, namely soccer players. In addition to having to go to school for 8 years without receiving income, they're also required to do residency, which pays very little. Soccer players, on the other hand, can be making so much money when they are children because the club is already paying them to be there. I do not see how it's fair for athletes to be making so much money. I love watching football or soccer games on TV, but I just don't understand how they can be making so much money to entertain a crowd. I think doctors should be making more money than athletes should because doctors are doing more for people by saving lives, prescribing medications, and so much more. Although I am not a professional athlete, I am a college athlete that works hard both in school and academics. I always thought that athletes had it the hardest, but looking at all of the pre-medical students, I can see how much harder they work than athletes. There are so many times where I have free time and I find myself going hiking or hanging out with my friends, but it seems like pre-med students are constantly studying and preparing for tests because not everyone can make it in the medical field. Only a select few who work the hardest are the ones that make it. In soccer, a lot of the times, all it takes is money for a club to hear your name and let you try out for their team. Without doctors, people would constantly be dying. However, without sports, people would still be fine. In the end, I believe that soccer players should not make more than doctors because doctors do more for people, they put in more time, and they work harder. People will not remember just any soccer game that they may have seen on TV. They will remember the time the doctor performed surgery and saved their life.